Thank you, Mr. Speaker. Mr. Speaker, my question is directly related to the responses given by the Cabinet Secretary from the question asked by Senator Muma. Now, Cabinet Secretary, you've indicated that the biggest challenge is the debt owed by county governments, of about 6.2 billion to KEMSA. You've also indicated that SHA, which you know very well, that in the financial year 2024-2025 was allocated a total of 25 billion 798 827 666 shillings, which is up from the initial of 11 billion 899 413 839, which means there was an additional 13 billion allocated to SHA to be able to ensure that they provide this medicine to the people. If we are having problem, and I really would like you to pay attention to my question, if we have problems with drugs being administered in hospitals because county governments are not collecting the drugs, because they have not paid the money to KEMSA, don't you think that it is time as a ministry to develop a system where manufacturers, because the question you ask is about manufacturers, where drug manufacturers only release the drugs upon payment by SHA, so that these patients, and I speak this because when I was young, I was diagnosed with petit mal epilepsy. So I know the dangers of people who end up having epilepsy. So my question is, don't you think that it is time that you develop a robust system that can ensure that all those manufacturers list their drugs and only draw them down upon being paid, so that you don't have to incur all these debt? And I'll give you a very good example. It is like a supermarket. If you walk into a supermarket, you'll buy sugar. That supermarket does not own that sugar. That sugar has been placed there by a manufacturer. So the only time that it is released, it is when he's paid. We have SHA, 25 billion. And then you also have counties collecting money from ONSO's revenue to use. This House has passed a law. So can you please tell us how we solve that problem once and for all? It is not right for people who are sick, people who are epileptic, disabled people who are epileptic, to stay without drugs in their hospitals because county governments have not paid KEMSA for the drugs that they are collecting. Please answer that question diligently, and if you have not understood it, ask me again and I'll explain it. Thank you, Mr. Speaker.
Madam CS.
Thank you once again, Honorable Chair and Honorable Member. So indeed, drug availability is really critical for us. We have one of the key challenges that we have faced as a ministry is ensuring that the drugs reach the last mile and ensuring that we have accessibility to essential medicines. And under the UHC, that is the Taifa Care, we are really working tirelessly to ensure that, first of all, we have recapitalization of medicines in KEMSA, and again, that they are reaching the last mile, that is to the facilities up to level 2 and 3 for accessibility by patients. Now, what we have talked about and we are really ensuring that we implement is that SHA will pay, the counties will, SHA will, after the counties have requested, what will happen is SHA will pay directly for medicines before the money is released to counties. That is, when they receive the money from from the claims, part of the areas, apart from ensuring that they are paying the claims, they will ensure that medicines are also withdrawn from that money, and that way before the money is released to the county. So it is an area that we are looking into together with SHA to ensure